Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. Rural ER doc here. 35-year-old female walks in with right-sided jaw neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Physical therapist had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15-20 cups of coffee daily. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Had a buddy who was an EMT, he was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawn mower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital." Saw a chart once where a person came in for a burn to their eye. They told the DR they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling suicidal. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. This happened in med school on my OB/GYN rotation. Patient: who's the baby gonna look like? Me: what do you mean? Patient: well, is it gonna look like the dude who got me pregnant or the guy who's been nutting in me the last few months? Me utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Edit fixed a typo. Had a patient come in for facial burns because he smoked while wearing his the same week. This was one of the funniest yet cutest one, was a student doing a shift in andrology reproductive health. Doc: so you're trying to have kids but not managing to. So do you have any other kid? Patient: yes doc, I have one. Doc: okay, so we need to do this and this and that. Patient: okay, great. Then he proceeds to visit him and stuff, after which he goes away. After a couple secs he knocked the door again saying, "Hello doc, my wife told me that it would be relevant to you that the son I have is adopted, but that's make no difference to me, I always considered my own son." Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there, however, has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. I was using meth for weight loss. Have heard a few times actually. Vet Med here. We get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control. So we often get ones with thyroid, diabetes, heart issues, etc. and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they are still giving the they stopped it cause they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection, and she said, Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs. I left that one to the doctor. So, you're lactose intolerant? Yes. And you knew this before? Yes. And you drank a milkshake? Yes. What size? Large. The rest of the night was the kid screaming and groaning in the ED waiting room. Literally yesterday. Consumed 8 cans of Red Bull in a 2-hour time frame. Presented with palpitations and severe chest pain. I worked in cancer research surgery a couple years ago. There is a good amount of people who will refuse to have a small removal surgery because they think holistic medicine or praying it away will work. They always come back and we always have to remove so much more. One time a patient had a melanoma on their calf and the doctor wanted to do a simple wide excision, but they left because they wanted to pray it away. Came back a couple months later because it got bigger and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point too. Woman comes in with no prenatal care to labor and delivery in labor. OBGYN resident taking a history. Do you have any allergies? Patient: yes, I'm allergic to water. Resident: okay, what kind of reaction happens when you drink water? Patient: oh, it makes me pee. Yeah lady, that's a feature not a bug. A woman called 911 because a cougar attacked her cat. She thought we could help the very clearly dead cat. A man called 911 because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy butthole. Took him to the ED because we have to. The doctor asked the patient if he had put the cream on his butthole that he gave him last time. Patient said no. Next time patient called us for his itchy butthole, I offered to put the cream on his butthole for him. He declined. Took him back to the ED. When I was in the hospital as a patient, there was this one guy in ER who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s, it is a mystery to me how this guy survived that long. Former practicing surgeon. Male came in with a small bowling pin up his backside, for the 3rd time. I worked for an OBGYN who had a patient he prescribed vaginal suppositories for. When she complained of no improvement, she came back in for another exam. He found 7 foil-wrapped suppositories in her vagina. I worked EMS for years. It never ceased to amaze me the things people will do to themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his penis through a large metal nut. Once he got erect, he couldn't get